As you think about your upcoming labor and delivery, you may want to consider the use of a birth plan. Now, the word plan is somewhat of a misnomer. We cannot plan birth. The baby's the only one with a plan, and the rest of us do our best to keep up with that baby's plan. So some couples choose to call it a birth wish list or a birth preference sheet. And this is simply a list of things that are important to you as a mother or as a couple for the birth of your baby. Now, as you talk to friends, as you read online or take classes, things will come up that may be important to you. And it's important to find out what your options are and educate yourself as to what you can get that day. Keep your birth plan simple. Nurses are not interested in reading a birthing philosophy essay. They just want to know what they can do to help you. Full sentences aren't even necessary. Sometimes bullet points are very helpful. Oftentimes, a good birth plan or birth wish list is broken down into stages of labor. Labor stage being one that will focus on coping techniques. Perhaps the environment of the room isn't important to you. Another stage of labor would be the delivery phase. If it's important to you to have options of positions of delivering, that would be something important to put in the birth plan. Another stage, possibly for the birth wish list or birth preference sheet, would be the baby care. After the delivery, what's going to be happening with the baby? Is it important for this mother to have the baby up on its chest right after delivery? It is important for her to have newborn procedures delayed. You can request these things on a birth plan. My very favorite thing that a birth plan does is it communicates two things about you as a mother and as a couple. One, that you've prepared for this day, that you've taken the time to educate yourselves. And two, simply that you have preferences about what's going to be going on this day, that you care. It's a big day in your life. It's important to make your wishes known. After you formulate your birth plan, take it into one of your appointments with your care provider. Let him or her go over it if they have any suggestions. They'll also let you know if there's anything they do like to do or don't like to do on your birth plan. And it's something you can discuss with them. It will also, if you want something different than what they typically do, it will help remind them during labor and delivery and the nursing staff that you want something just a little bit different than that doctor's typical style might be. Your doctor or midwife can take that birth plan and put it in your chart, and it will go to the hospital with your paperwork. Also take a couple of copies to the hospital with you. Give them to the nurses as you check in. Nurses will kind of sort themselves according to what they enjoy. Not every nurse likes working with a hypnobirthing couple per se, or a couple that's using birthing from within method, or an unmedicated delivery. So to get a nurse that supports what you're doing, put that on your birth plan. Hospitals have come a long way in honoring birth plans. They find that it helps moms as they are involved in the decision-making process. It helps them to have positive experiences. So as you think about what's important to you, write it down, put it in your birth plan, take it to your care provider, and let them become a part of your birth team as you strive to have a positive birth experience.